I see myself every day. I look at myself in the mirror every day. So I always knew, what I looked like. And as the weight started dropping off, I didn't notice anything. I started to have to buy new clothes. I would put on something and it was kind of hanging off. And I was like, okay, this doesn't even look good anymore. I was running out of holes in my belts. The first 40 days, I lost a pound, about a pound a day. I decided to do the surgery because I wanted a jump start for my weight loss. I had tried diets before when I was younger. I had been on a lot of diets, and some of them worked, some of them didn't. I had tendencies where I would start the diet and start strong and then just kind of taper off from it like normal people do. And so finally, I went to my primary care physician here, and he would always talk to me about weight, and he told me one day, he said, have you ever thought about getting weight loss surgery? And I said, yeah, I had thought about it, but I had never really looked into it. And so he recommended me to Wake Forest Baptist and told me that they have these orientation sessions. So I went to an orientation session, and from there I started on the program. I felt like this surgery was going to give me the extra just kind of push that I needed, because I tend to be pretty disciplined when I want to be, but I justify my lapses. And so with the surgery, you can't really justify that because your body is kind of telling you what to do. Having the support system in that medical team really helps, because you can contact them whenever you need to, and they have looked at every aspect of your life, not just necessarily your weight, but they have looked at every aspect of how you function daily to see where you could possibly falter in the program. And I think that's what makes a good program. The bigger guy. And I knew I was a bigger guy, but I was like, okay, whatever. This is what I was looking at. So when I started losing weight and everybody was like, oh, you're losing all this weight, I didn't see it because I was seeing myself every day. The person that you see on the outside now is the person that I always saw when I looked at myself. So it was just, I was larger to everybody else, but to me, I always looked like this. And so now my exterior for everybody else matches what I always saw.